Third one is it relates is to be a North Star. So if there is a crisis, whether it's a family crisis or a societal crisis or cultural crisis, we don't go to the young ones to ask for advice. We'll go for the old ones who have lived through that crisis. And that's also very important. Many of us do, we want to share our wisdom how to go over the crisis. And I think the fourth one that relates to your quality of life is to live and finish at our own term. We don't want to be moved around in a wheelchair for 5 years.
Yeah.
So these, I think, if we break it down, then almost everybody will find something in one or more of these buckets.
Actually, Dr. Panda, that is an amazing way of looking at it. I think that is an amazing framework. I don't think we've ever seen it like that, but it is an amazing way that you frame that. It's very articulate, and I think it would also help because then you have different people, but that is the paradigm that you could look at and puts a new spin on longevity, right? It's
Means why do you want to? And if there is no purpose, then
yes.
you know if you want to go to a place, that should be a purpose. Why you want to go to visit that place? Like, I don't know, I'm not going to say Switzerland to get a dosa in a South Indian store there, but there is something else. So similarly, you got to define the goal that's so overwhelming for you that you will save up and go to Switzerland. So similarly, I think we have to bring that mindset. We have to find deep inside what is driving them now and what will drive them, what they're missing. Is there a second act or third act that they're missing? They can do it.
Actually, that's an amazing point to regeneration. We have to find that deep purpose. And because of that, I'm going to ask Dr. Arvind what his thoughts on this deep purpose or longevity is. Because, what is your version of what you want in terms of longevity? You're also on the biopic program. So that is a really good question to actually ask you.
Well, I'm putting myself and my wife through it because we're sort of guinea pigs for ourselves to see, because before we recommend it to people to try it out.
Yeah.
So we just want to see how it feels. But for me, just being able to function every day in a manner that's useful to society and myself is, I think, crucially the most important thing.
Yes.
And, whatever time or whatever effort it takes to achieve that, I think is worth investing in. I think we underestimate how badly it can affect us when we fall sick. I mean, just take a simple thing like a flu, right? So I came back from the lifestyle medicine conference in Ahmedabad with a very bad cough, and I lost about 2 weeks of my training. And I can tell you it was very unpleasant, and that was not even a major illness. But just that little disruption in your normal, your feeling of well-being can be so disappointing and can affect you in such a serious way, mentally also, that I think it's worthwhile realizing that this the gift of good health that we all enjoy presently is something that we should really treasure and value and not let go of so easily.
Thank you, Dr. Arvind. It's really interesting because it's actually that's a fantastic summation of the story. I happened to be there with Dr. Arvind in that conference, and I think the unusual part of that is he did go to sleep late and ate late because he never does that. And that is quite interesting if you really look at it as a practical story of everything that you've said so far. Immunity. This is exactly a case in point because Dr. Arvind is superbly disciplined with his existence. He's like he's meticulous. This one time the whole clock actually spun around, and I know he had a late night. There was a lot of, exactly like you described it, there was a lot of light and a lot of food very late in the evening, which he's very unused to. And it's thrown this immunity off and this whole idea of psychoneuroimmunology and all these things. Dr. Panda, what are your thoughts on those things?
Yeah, so this branch called neuroimmunology is evolving now, and there are a few aspects. One is when you're thinking about immune cells, it's not only immune cells are not only in our blood, the immune cells in every tissue, and also they locally stay in the brain. It's almost like the night watchmans; they're always there. But we are always thinking of immune cells as the fire truck, that only when there is inflammation or there is something, then these immune cells have to come and take down the fire. But actually, there are local cops, so they are everywhere. So one aspect of neuroimmunology is immune function. The immune cells in the brain are, when they are disrupted, then they can cause local inflammation. And some of the neurotransmitters are also shared with immune cells, like for example, histamine is a great example, and a few other things. So in that way, sleep disruption can potentially affect the local immune cells in the brain. But sleep disruption can also act on the autonomic nervous system, and since the autonomic nervous system is connected to many peripheral organs where the immune cells also reside, they can also activate or suppress the tissue resident immune cells. And this is very new area of science, because neuroscientists always looked at the under the hood, and then the immunologist always bled people and mice and looked at the immune functions. And this is where the crosstalk, cross discipline is important to understand how autonomic nervous system, sleep disruption, and all this stuff affect the peripheral immune system. So one thing that's fairly well documented is sleep disruption actually causes a lot of peripheral inflammation, and particularly inflammation in proximal to the gut. And there are quite a few mechanisms now shown. The bottom line is, these kind of research, although they are not giving us a solution, they are giving us a reason why we should be more mindful about that sleep restoration and having good brain health.
Thank you, Dr. Panda. Dr. Arvind, any last thoughts or any questions you'd like to ask?
I already think I asked him this question at the biopeak thing, but one of the chemicals that has been very fascinating for me to read about is orexin.
Yeah.
So tell us what's happening with orexin, because I read recently about the new sleep medications, the DORAs, the dual orexin agonists. And apparently they have an influence on the lymphatics in sleep, and they've also been, now I think some studies are ongoing where they're trying to show whether that actually changes the trajectory of cognitive diseases like Alzheimer's and Parkinson's and so on.
Yeah, so there are quite a few questions there. Yeah, so the orexins were originally discovered as a strong sleep neurotransmitter or hormones, whatever way you put them. And human and dogs who have a mutation in orexin, they have narcolepsy. So that means all of a sudden they will fall asleep. And but at the same time, the orexin system is also linked to metabolism.
Yeah.
So for a very long time, the idea was, if you target this orexin system, perhaps you can bring restorative sleep to a lot of people. And recently, again, in the last 10 to 12 years, there is this new idea that there is glymphatic system, a lymphatic system in the brain that drains our gunk when we sleep. And then there is this new idea that when neurons fire together, then they shower together. So that means when they fire together, so in our sleep, neurons fire together, and that's why we see these easy waves. And when that synchronized firing happens, then this lymphatic system also drains our gunk from the brain. So then, and now we can link that this orexin agonist may help us with better sleep. And also, since these orexin agonists are working on the central nervous system, and we don't know whether they are helping the neurons to fire together, and maybe that's why the lymphatic drainage is improving. But this is very exciting. And one thing, again, coming back to lymphatic system and brain circulation, one thing that is very clear now is a lot of our, when we get older, I think the cardiologist used to say that you are as old as your endothelial system or the blood vessels, right? And they are always thinking about the blood vessels in the heart. But actually, there are a lot of blood vessels in our brain. And And brain uses what, 10 to 15% of our blood circulation?
More than that. 20%.
20%
Oxygen consumption.
20% of oxygen consumption, and it weighs only 0.5% of our body.
Yes.
So all that oxygen has to reach there through capillaries. And as we get older, and also people who have a high LDL cholesterol and plaques, then some of these blood vessels get either they get damaged or they get clogged. And then the terminal blood vessels are actually in the hypothalamus and in the brainstem. And that's why as we get older, when there is less blood circulation and oxygen to the hypothalamus and brainstem, then the autonomic dysfunction starting from the brainstem or the hypothalamic dysregulation, including sleep disruption, metabolic disruptions, that happen. So one idea now is, can we improve blood circulation to the brain, and whether that will improve brain age, so you will have a youthful brain. So along that line, I was actually at the Society for Neuroscience conference, and luckily one of our posters was selected for the press release, but I will not talk about our poster because it was in mice. But what I heard that was really exciting and surprising to me was there was a study on humans, and this human retroactive studies looking at which medications people are taking and what is the impact on cognitive decline. And what they found was women who were taking Ambien, which is a sleep medication, benzodiazepine, they mostly take, so they are more likely to delay their AD, Alzheimer's disease onset. And that's really interesting because essentially what it is telling is, if you sleep enough, if you have a sleep problem and you're taking care of the sleep problem, whether it's Ambien or whether it's melatonin or whatever it is, or behavioral lifestyle therapy, CBT, then that might actually slow down your brain aging. Because at the end of the day, if you think about it, if my kidney is aged, then I have an option of replacing my kidney. The same thing goes with liver, to some extent heart, and I get pancreas, I can cut off a part of the gut and all that stuff. But once the brain ages, I don't think there is a brain replacement.
Not yet.
If there is, then I'll line up. I'll put my name for your brain. So that's why brain aging is so important, and sleep. I mean, sleep is important, but then if we understand more and more about what nurtures, what are the lifestyle factors, or what are the other medications that actually sustain blood flow and oxygen flow to the brain, and conversely drains the brain of all the bad stuff, maybe that will ultimately affect our cognitive health and then really cognitive lifespan. Because at the end of the day, if I cannot remember my own name and my family member's name, then what use is my existence, even if my liver, heart, everything else is working fine? So brain aging is the ultimate frontier of aging.
Thank you, Dr. Panda. I think, that is a great way to finish this whole conversation. But I think that what we got from it was the fact that, this purpose has to be defined. If you really want to live long, you have to define your purpose. That really came through for me today. Longevity is all about defining this purpose. Yeah. And then I think the next thing is, I'll use our framework on biopic, on detection. Actually, detection is quite simple today because we have wearables, we have so many tools for the simple detection, right, of sleep latency, like you talked about, and the quality of sleep. Even those small things seem to be making such a big impact on existence because of the feedback and the mentality loop that you were talking about. And the next part on optimization actually is, I love the fact that you brought up the idea that you have two clocks, and the food clock basically is more conserved than the brain clock, so it just takes over everything. So that would make such a big difference, especially for aging in India, because I think our food clocks are completely dysregulated. Yeah. And it occurs to me that maybe, like you said, a lot of our metabolic problems are because of our perception of this idea of when we eat, and we may not have any idea about it. So what we term as gut issues may actually be a sleep issue because of the repair and everything else that you brought up. And sorry.
Yeah, I mean, you brought up another point when you're talking about detection and other stuff. What we are also we are discussing or you are bringing up is we have more sensors and more indicators on the dashboard of our car than in front of us. So, for example, when we drive, we are constantly looking at our speedometer, our engine, whether it's heating up, and then all this stuff. But in our daily life, we don't look at any of our parameters. Means, I would say that most people will discover health by falling sick, right? Only after we fall sick, we go and get tested. And when I was working long time ago, when I started working in India, I was working in a chemical plant, and our safety officer came and said, "Don't discover safety after an accident." Okay, and in India we do that because we go to doctor only when we are sick. And the very simple idea that there are certain, we should have a health dashboard where we can have this few testing, and those testing, for example, my engine oil, I have to check only in once in 4 months or once in 6 months. So similarly, if we really define a panel of tests that give us a good idea of how my brain is doing, how my kidney, liver, and all this stuff is doing, we can take care of nearly half of the problem, because it's almost like standing in front of the mirror. And once we are presented with that data, then we will begin to take action if we have that goal. If we have that goal, and most people do have that goal. So I think we have to bring in this from the vicious loop of ignorance to the virtuous loop of knowing the purpose and knowing our data and having potential solutions. And the most powerful solutions are the daily lifestyle, 4 or 5 things that we can do.
Thank you so much. I mean, I think it was a real pleasure having you both, and what a great conversation. I will just leave you with this. The most regenerative thing that you can do for yourself is sleep. Thank you.